What's going on there, guys? Roberto here with Innovative Sports Training. Time for another Health Detective Talk series today. Today's topic is how accurate is your lab report? Now, this is going to be somewhat of a controversial topic. Some of you out there I know are in the medical profession. Maybe you're a nurse, maybe you're a doctor, maybe you're a therapist who works closely with doctors. So some of the stuff I'm going to talk about you may not agree with, and that's fine. I mean, hey, we live in a free country. We can all have spirited, diplomatic, respectful debates about this. But I've done a lot of research in this area, and I'm a holistic person. I believe the body has a way of healing itself if we let it heal itself without the use of a lot of medications and vaccinations. But that's more topics in the future. Let's focus on lab reports. Now, what I'm going to go into is this. When you go to your average lab or your doctor to get a physical, you get a lab report with different reference ranges on that report, right? So you fall within a certain reference range. So within that reference range, there is a depressed range of being too low or an elevated range of being too high. Now, here's the difference. I'm going to talk about functional and optimal ranges. That's the primary focus of this topic today. We're going to talk about what's functional and what's optimal. A conventional lab report is based on a sick population. I've said it before. Most Americans are overweight and or obese. That's about 2/3 of Americans out there. Now, many of those people are still functional. They still live, they still go to work, they get up in the morning, take care of their families, but they've got some issues going on physiologically, biochemically, and even somewhat medically in their lives. They're not what I consider extremely healthy. So the reference ranges that you will get on your lab report is based on really the worst of the best and the best of the worst. Now, some may not like that statement, but it's true. It's based on a sick population, which is about at least half to 2/3 of our population, closer to 2/3. You go from state to state, Kansas, Missouri, Oklahoma, Nebraska, California, Michigan. In each state, the lab reference ranges can be different. So why is that? Why all of a sudden you could be within range in Louisiana, but out of range in California? Think about that for a second. The ranges are extremely broad. In other words, typically within a doctor's range, you're going to be here. Here's low, here's extremely high, here's functionally low, here's functionally high. Just a little bit above that. You're going to fall within this range right about here on most lab reports, and the doc will tell you that you're normal. You still feel like crap. There's still things going in your life that don't feel right with your body, but the doctor says your lab report's okay. Can you all relate to this? Now, in a normal lab report, they're looking for pathology. In other words, they're looking to see what sort of disease you have. They're looking to prescribe medication. If the medications don't work and work and work over and over again, guess what? Surgical procedure. Right? Can you all relate to this? So that's usually what happens. And as you get older, let's face it, people over the age of 50, I think I read somewhere, in fact I did read this, that the average person over the age of 50 is on about 5 medications. Is it working? I'd say no, it's not. And if that doesn't work, surgery. Not the direction I want to go in my life, guys. Now, a few years ago, I came into contact with a company called Functional Diagnostic Nutrition. And I became certified in reading lab reports, in doing labs myself. They base their numbers on what we call a functional range, which is based on, which have tight ranges based on the healthiest population, the healthiest percentage within our population. That's usually about 1/3 of our U.S. population is we consider very healthy. Now, this type of report will focus on identifying physiology, not pathology. Physiology and the biochemistry and the biostressors going on within the system. We're not here to try to diagnose diseases. We're here to find out what's stressing you out in terms of your chemical stress, your nutritional stress, your physical stress, your emotional stress. What is stressing you out, making you get within these low or high ranges? In other words, what's stressing you to lean more towards the disease process? That is what the physiological aspect will do. We will evaluate that. The functional lab will also resolve stressors by implementing lifestyle recommendations of diet, rest, activity, maybe some supplements. And I'm not real big on taking a lot of supplements. But the main thing is diet, rest, activity, and exercise instead of drugs. Now, this is probably the most important right here. With the functional lab approach, optimal approach, you treat the person. We treat you, not the lab result. Let me give you an example. You have high cholesterol. What does the doc recommend? Statin drugs. Statin drugs, guys, they're not good. They can lower your CoQ10. They can destroy glutathione within the body, which is a major antioxidant within the body. They can cause more problems than they resolve at times. They will lower your cholesterol, yes, but they will also eliminate some other important functions within the body for life, for good health. And that's not what you want. And I'll give you another example. Getting back to the lab ranges here. Just a few years ago, I got a physical myself. In the lab that I got my physical from, the reference range for cholesterol was 220. My cholesterol was a little bit less than 200. It was about 198 or something like that. I had a client of mine I was working with who came to me and we did a lab assessment on him. His cholesterol was about 210. The lab that he went to, the reference range was 200 or less. 200 or less. So what did the doctor recommend? Statin drugs. Now he refused to do it, thank the Lord. He refused to do it. And I saw a few things, other things within his lab report that was stressing him out and making that cholesterol jump up a little bit high. And please listen to my cholesterol health detective talk too, because I'll go into more detail on that. But the reason his cholesterol was high was because his triglyceride levels were extremely high and his blood sugar was very, very, very high. But the doctor didn't tell him that. So what did the doctor recommend? Statin drugs. What did I recommend? Change your lifestyle. Cut down on the sweets, cut down on the breads, cut down on the carbohydrates, become more active, do more walking, start exercising. He got better. Ha! Amazing! Guys, the body will heal itself if you let it. Now I know, as I said earlier in this presentation, this is somewhat of a different approach that many of you are not familiar with, because many people rely on their doctor like their doctor is almost God. And guys, I'm here to tell you, let me just say this. You should have a doctor in your life. Doctors are important. If you're having some sort of life-threatening situation, I'm not here to tell you to get off medication. I would never do that. But all I'm telling you is this, that there's a lot of things underneath. We peel away the layers. That's the purpose of these talks here, to find out what is stressing you out to get you into that disease process. On the other end, yes, doctors are very good trauma people. They can help you in a lot of different ways that way. But doctors are not trained in the area of holistic medicine. They are trained to do this, okay? To look for pathology, to apply medications. That's what I'm saying. So guys, I hope this has been helpful. Please check me out at my facility here in Blue Springs, Missouri. I also work with people online. I do health assessments, I do lifestyle assessments, I do hormone evaluations, I do nutritional evaluations, I do training, I do sports performance training with athletes. I do it all. I can help you. If I can't help you, I'll find someone or some way to help you. My number is 816-405-7703. My email is rwpsports@yahoo.com. Guys, become self-empowered. I challenge you to do that. Keep tuning into these topics and learn and educate yourself. Guys, take care and God bless. Bye-bye.